Okay, so today we're doing a deep dive into something really, really important. How to quickly and accurately confirm a pregnancy. And we're going to be looking at services right across the UK using this fantastic guide from the experts over at Blood Test UK.
That's exactly it. Our mission today is all about pregnancy blood tests. I mean, what are they? Why are they so much better than the other tests out there?
Right.
And, what are the massive benefits they offer, especially when you can get them locally, say, in a place like Pontypool?
Okay, so let's get right into it. The blood test.
Yeah.
What's it actually looking for? How does it work?
Well, it's all about a special hormone called HCG.
HCG.
Yes. And what's amazing is that once a pregnancy starts, this hormone, it floods into your blood. And get this, the level of it actually doubles every 2 to 3 days in a healthy pregnancy.
Wow, every 2 to 3 days.
Yeah, so the test can track that rapid increase.
So it's not just a yes or no then. That tracking is the key part. What are the real benefits of getting that information so early?
Oh, the speed is everything. The guide from Blood Test UK makes it really clear. It's about spotting problems early. Really early.
Like before you might even have symptoms.
Exactly. I mean, if the HCG levels aren't doubling like they should, that could be a sign of something serious, like a threatened miscarriage or even an ectopic pregnancy, which is, potentially life-threatening.
So that accuracy is vital. Now, our source, Blood Test UK, it talks about 2 different types. There's qualitative and quantitative. What's the difference for someone just, listening in?
Yeah, so a qualitative test is super simple. It just tells you yes, a yes, or NO is the HCG hormone there.
Okay.
But the quantitative one, that's the real powerhouse. It measures the exact amount of HCG.
And that exact amount is what lets you do the tracking you mentioned.
That's it. And that's where the real power is for prenatal care, whether you're in Pontypool or anywhere else.
And compared to, say, a normal urine test you'd buy at the chemist, the difference in timing must be huge.
Oh, it's massive. A blood test can find a pregnancy as early as 6 to 8 days after ovulation.
6 to 8 days? That's incredible.
Yeah, it is. I mean, that's way before you've even missed a period, a urine test. You usually have to wait until after a missed period for a reliable result.
So you're talking about days, maybe even a week or more of knowing sooner. That psychological benefit alone sounds huge.
It really is.
Okay, so what about the actual process? Is it a big deal? Is it complicated?
Not at all. It's so quick. A nurse or a healthcare worker just takes a tiny sample of blood from your arm. That's it. You're in and out.
Right, let's talk about the practical side of things, like money. The NHS offers these tests for free, right? So why would someone in, say, Pontypool pay for a private test? It can be, what, £40, £150?
Yeah, it's a really good question. For most people, the NHS route is perfect, and it's free. But people go private for a few reasons. Speed is a big one.
Getting results faster.
Exactly. Also, convenience. Maybe you can't get a GP appointment quickly, and some people just prefer the privacy. Plus, private clinics often guarantee same-day results.
And insurance might cover it anyway.
That's a key point. A lot of health insurance policies will actually cover these tests, which, definitely helps with the cost.
That makes sense. Okay, last practical question. The guide from Blood Test UK. Does it have any tips for what to do before the test?
Just a couple of really simple things. First, drink plenty of water.
Yeah.
Stay hydrated. It just makes it easier to find a vein, makes the whole thing smoother.
Okay, easy enough.
And also just, bring your ID and a list of any medications you're on. It just avoids any delays at the clinic.
So really, when you boil it all down...
When you boil it all down, what we're saying is that getting that early, accurate information is it's the best possible start for a healthy pregnancy.
Yeah.
Proactive testing just leads to better outcomes. It's that simple.
Absolutely. And that leads to a really interesting final thought for everyone listening. We know these quantitative tests track HCG as it doubles every 48 to 72 hours.
So, what else can we learn by regularly monitoring simple things like that? What other hormones or proteins are changing that quickly in early pregnancy that we could be tracking for even better health insights? Something to think about.